Hi, I'm Dr. Nicholas Swang. I'm a physician case manager with Advanced Medical, and I'm trained in internal medicine and nephrology. One of the patients that I worked with was a 55-year-old gentleman with multiple complex medical conditions. These included ankylosing spondylitis, gastric ulcer disease, and a new diagnosis of osteoporosis. He was looking for help managing these complex medical conditions. In particular, he was still having some back pain. He wanted to reduce his need for chronic acid-suppressing medicines, and he wanted to better understand his new diagnosis of osteoporosis. We found two spectacular experts to help this patient. Dr. Robert Schmerling is a rheumatologist at Harvard, and Dr. Weisiger is the chief of gastroenterology at UCSF. After reviewing this patient's medical records, his lab tests, and his imaging, Dr. Schmerling recommended that this patient's ankylosing spondylitis was actually under pretty good control, but he recommended that some of his back pain may be due to degenerative disc disease rather than active ankylosing spondylitis. So he gave the patient some additional plans for managing his pain and possibly switching anti-TNF therapies if he were to have worsening problems with his ankylosing spondylitis in the future. Dr. Schmerling also recommended that the patient stop receiving intermittent doses of glucocorticoids, which he had been receiving off and on for upper respiratory infections, and that these were probably contributing to his new diagnosis of osteoporosis. Finally, Dr. Weisiger gave the patient a number of lifestyle modifications and dietary modifications that he could use to try to reduce his need for chronic acid-suppressing medications. When we reviewed these results together, the patient said that this was exactly what I was looking for. I was looking for a service to take a comprehensive view of my multiple medical conditions so that I could stay fit and healthy for the next 40 years. He said that each of these reports contained a number of golden nuggets that he could use for his treatment and discuss with his providers so that they would elevate the level of discourse he had with his providers and improve his health going forward.